Hi everybody, how are you? It's Dr. Emily from the Evidence-Based Fitness Academy. I want to take a few minutes to speak to you about breathing and how you can sequence breathing patterns or diaphragmatic breathing with foot-to-core sequencing for our optimal stabilization patterns. So breathing is obviously important. Your diaphragm and your pelvic floor are part of the same myofascial line, which means to optimize the pelvic floor, we must be tapping into that diaphragmatic breathing. Most people start diaphragmatic breathing on the floor, making sure that the abdominals are lifting and that the rib cage is expanding both to the sides as well as to the back. That's the way that I would recommend you starting this as well. But then when you bring it up to your feet, that's where we want to bring this diaphragmatic breathing concept to our pelvic floor / foot to core sequencing. So let's say that you had already started your diaphragmatic breathing on the floor. Your client or patient is familiar with that movement and the correct alignment of the rib cage. So once we bring it into a standing position, we want to assume that same position. So we're going to do it on a single leg, because all of my activation techniques are initially done on that single leg. You want to make sure that the rib cage is in line with the pelvis. So if there's any sort of flaring of the rib cage, just make sure that you correct that with your client. You want to find proper knee-foot alignment, spread the digits, find your foot tripod, and you are nice and stable. Opposite leg may be in a kickstand position. Now you may have your hands on your rib cage to give you some of that cueing, or an abdominal on your hand on your abdominals and a hand on the back. And what we want to do is start with our diaphragmatic breathing. And then as you are exhaling, you're going to start to lift the pelvic floor and push your foot down into the ground. So you're doing your short foot pelvic floor sequencing, matching it with the breath, and then we inhale. And then exhale, push your foot down, lift the pelvic floor, and then inhale. And then exhale, lift the pelvic floor, push the foot down. And you want to find this in a very sinusoidal or rhythmic type pattern. As a technique, I like to have breathing patterns not be harsh, because again, the foot to core stability that we need is ultimately used for bipedal locomotion. And when we are walking and every single time our foot hits the ground 10,000 times a day, we want to have that relaxed breath, which happens to be timed with the diaphragm and pelvic floor and the foot in a very relaxed technique. The way that I like to use this, again, starting on the floor and starting to sequence that diaphragmatic breathing and then bring it up to that standing position. You can just start doing the diaphragmatic breathing standing and then sequence it with the floor, doing 10 on one side, 10 on the other side, and then you can actually start to bring it into that full single leg stance. Diaphragmatic breathing, lift pelvic floor, push the foot down, inhale, and then again sequence. Remember that it is controlled and relaxed. From here, I would start to add in all of the other exercises that we do in the BTS program, whether that is side lunge, jumps, landing, etc. I hope you enjoyed, and remember, stay barefoot strong.